After my evening series of lectures, I, Professor Twattington Hairyballs, will tonight be focusing on toothache. Toothache is a common and dangerous ailment, suffered mainly by those in the lower classes. I'm joined tonight by my colleague, Professor Chumley Bumwash. He will be playing the part of the local commoner.
Hello, I'm Professor Chumley Bumwash, and tonight I will be playing the role of a local commoner.
Together, we will be taking you through a role play of the communication skills necessary in the diagnosis and treatment of toothache. Greeting the patient is essential to ensure you become acquainted in each other's company. Mr. Bumwash, welcome to the Hairyballs surgery.
Hello.
I'm Professor Hairyballs.
Hello.
Yes. Have a seat, please.
Okay.
Thank you. It's important to gather information so that the correct diagnosis can be reached. Listen to the patient carefully at all times, mind. They may give something important away. So what seems to be the problem today, Mr. Bumwash?
Well, I was walking down the street. I was actually
Yes.
walking my dog.
I see.
And it was a Wednesday.
Okay.
And I'd actually just been to the shops. Because it was 3 sizes to it. But the thing that I felt was that my teeth were starting to actually hurt because sometimes when I was eating or drinking, I was experiencing a pain quite like nothing I'd ever felt before.
Just the teeth?
Yes, just
And
the
the
teeth.
gums?
Not the
The teeth? Yes, just the teeth. The gums? No. Only the teeth? Yes. And the gums? No. The teeth mainly? Yes, just the teeth. And the gums? No.
Okay, so only the teeth.
Yes, just the teeth, but also sometimes the gums. I find they bleed when I brush.
Yes. Examination of the patient will usually reveal visual clues as to the diagnosis. Mr. Bumwash, a quick look in your mouth if I may.
Of course.
Oh dear. A more thorough intraoral examination is usually required. However, in Mr. Bumwash's case, it's quite clear from his overall poorly kept demeanour that he has and is suffering from quite severe caries. The patient's condition should be described to them in simple terms. Use of visual aids may be indicated. Mr. Bumwash,
Yes?
I have reached the diagnosis.
Oh.
You're suffering from a condition called coronium aggregatoid reticularis infestation of the enamel space, or caries for short. These caries are singular elements. You have a number of them, meaning we refer to you as a carie patient.
Okay.
Let me show you briefly what's happening. The coronium portion of the tooth is connected intimately with the inferior dental space. The inferior dental space, via the lamina deltoid muscle, is connected to the brain. The brain stimulates and is stimulated by the nervous cells within the inferior dental space. Subsequently, you're feeling the discomfort. Yes. Treatment options should be described clearly and in plain terms, and the patient given enough time to weigh all matters. There are 2 real treatment options for a caries.
Right.
One is either extraction of the tooth,
Yes.
the other being filling of the tooth.
Oh, well, I'm not sure which one of those sounds best, really. I mean, I've got to think about this.
I really am going to have to coerce you into a decision, I'm afraid.
Well, I don't know. I mean, no,
Extraction?
sounds...
Good choice. Very good.
Oh.
A brief explanation of the procedure should follow, so that the patient can know what to expect at the next visit. For the procedure, we'll start by numbing you up. You'll be feeling a little squiv-eyed and generally a little Glenn Miller. Something like 4 shots of sherry should probably do it.
Okay, then.
One of the advantages of an extraction is that there are absolutely no chance of bleeding, infection or pain following the procedure.
That's very good.
Any questions?
Will it hurt during the procedure?
Yes, it most likely will. Sorry, Albin, there's nothing we can do about that. Always leave on a positive note. Remember, these are very simple people we're dealing with. I know today's been a little traumatic and I'm sorry about that, but at least you've had a chance to meet a rich folk like me, to see how the other half live.
Yes, I suppose so. Thank you very much.
That's no problem, Mr. Mumwatch. You take care now.
Thank you.
Okay. This session closes my evening series of lectures. If you have any comments, queries, or communications, please feel free to send me a wire to Telegram. Gentlemen, good luck with your dental surgery. Women, good luck with the nursing. And for me, it's back to Wimpole Street. So goodbye from me.
And goodbye from him.
Goodbye.